Acute stress disorder. Acute stress disorder is a psychological disorder that occurs within 4 weeks of a person experiencing a traumatic event. It should last for a minimum of 3 days and a maximum of 4 weeks. It involves an overwhelming sense of stress, fear, and panic. This disorder is considered a precursor to post-traumatic stress disorder, PTSD. If ASD is identified and managed quickly, it can decrease the amount of people who develop PTSD. The symptoms of this disorder are so severe that they significantly impair a person's ability to function and engage normally in their lives. This disorder manifests itself in the form of dissociation and severe anxiety. There is a high level of irritability, emotionality, sleep disturbances, and motor abnormalities. In addition, there is an effort to avoid potential triggers related to the traumatic event, which leads to a social withdrawal. One of the important symptoms of that is of flashbacks and images, which cause a significant amount of panic in the person and causes distress as well. The person also tries to avoid anything or anyone who can possibly remind them of their trauma. There can be multiple causes for one to develop this disorder. Physical and sexual abuse can be traumatic for anyone who experiences this. Situations involving extreme pain can also cause this disorder. Disaster survivors, assault survivors, and people facing possible chances of death can also develop this disorder. Seeking therapy can prove effective in dealing with this disorder. Therapies such as cognitive behavioral therapy can help the person to cope with the symptoms. It will address the cognition aspect, that is, the person's thought related to the traumatic event. It will also address the behavioral aspect and will target to change the behaviors that occur when the person experiences anxiety. Stress reduction strategies such as mindfulness can also help to reduce the symptoms of anxiety. Mindfulness involves being aware of the present moment and observing one's thought as they pass by. The idea is not to judge what passes by in one's mind. Focusing on the things around you can help you stay grounded in the present and remove your attention from the past and concerns about the future. The most important thing you can do for someone who's going through these tough times is to be there for them. Providing that space where they can talk and share things can play a huge role in their recovery process. If you or your loved ones require the support of professionals, you can contact Veda Rehabilitation and Wellness Center at 815-183-0000. A team of expert psychiatrists and psychologists can guide you to heal your trauma in your journey towards recovery. Please take good care of yourself.